Thanks very much for your time and welcome to the AM Report. Great to have you on. Just out of interest to help us anchor our conversation, I'm interested to find out what family medicine actually entails and whether or not it's any different to, I guess, any other, call it, discipline of medicine, if that's the right term to use.
So family medicine essentially in South Africa is what general practice is all about. I am very much a part-time lecturer and very much in clinical practice. So I work as a GP in Johannesburg, looking after families, patients from birth up until, old age, right through the families. And the practice of family medicine encompasses working with families and helping them to navigate through illness.
Right. And this is important for something like responding to COVID-19, isn't it? Because a lot of what we've come to learn about the virus is that it responds differently, at least we thought, across different generations. What does that mean then for a family response to the pandemic?
So I think that the family response, very much COVID-19 is being treated in large by general practitioners across our country as across many countries. You see a lot of stories about hospital patients, but in fact, most patients are managed at home, and that is in general by their GPs. It is the complicated patients who we're needing to refer to hospitals, and patients from the young and to the old are in general managed at home. It's true that elderly patients with comorbidities, high-risk patients are generally the ones who tend to get sicker and to end up in hospitals. But we are certainly seeing also young patients who are getting more serious disease and needing to go to hospital.
Yeah, and that in part, I guess, can be attributed to this new variant outside of young people, I guess, reckoning with the fact that they too are not exempt from severe illness. How should this be viewed by a family unit in South Africa?
So the new variant has been present and was announced in the middle of December. Viruses do mutate, so it wasn't really a surprise that we have a new variant. And in fact, it shows how well South Africa genome tracing and the genome project actually works, in that we have managed to identify it. What we know about the new variant is that it seems to be more transmissible than the old variant, up to 40 to 70% more transmissible. In other words, it's much easier to spread the infection. At this stage, we don't really know if it's causing more severe disease, and that is still to be found out.
It does introduce an interesting complexity, though, doesn't it? One of those has to do with whether people should quarantine before going back to work. I don't imagine a situation where everyone is able to do that, at least everyone who's been on holiday. And so what becomes the medical advice then to people grappling with that question?
So the medical advice is that anybody who is infected with COVID-19, either if you have symptoms, a cough, a sore throat, loss of taste and smell, headache, muscle pains, you need to isolate for a 10-day period, even if you don't get a test. Ideally, try and get a test. If the test is positive, you need to isolate for a 10-day period. And that would mean that if you are in Cape Town and you have symptoms or you are sick, you need to stay where you are in Cape Town and not get on a plane bringing illness with you across to Johannesburg. The same goes for somebody who's been exposed to COVID-19. We know that there are lots of cases on the Garden Route in KwaZulu-Natal, throughout the Western Cape. If people have been on holiday there and know that they are close contacts of somebody infected, they need to stay where they are and quarantine for 10 days before they make their way back to Johannesburg. In general, people coming back, if they've just been in a high-risk area, they don't obviously all need to go into a 10-day quarantine. However, I would really advise people to be extremely vigilant. My advice to my patients this week has been to treat everybody around you as if either you are infected and can give them the virus, and as if they are infected and can give you the virus. And that means that in every single interaction, you need to be wearing a mask, you need to be maintaining a distance of 1.5 meters, and you need to be sanitizing hands and trying to stay in ventilated areas.
Right. If that ought to be the starting point, right? Treating everyone as if they have the virus. How do we wrap our heads around things like children having to go back to school in a matter of weeks? That to me almost sounds like you sending them to go, into the eye of the storm, so to speak, and become vehicles for the potential spread of the virus. How do you see it?
And I think that school is a very emotive issue. I don't think that schools can or should stay closed all year. And there is no near end to the pandemic in South Africa or in any country. Schools are a controlled environment. I'm looking at your picture on the screen of kids swimming together in the beach, and that is obviously not a controlled environment. I don't really see the point in forcing kids to stay home for a 2 to 4 week period, simply because I don't think that they are going to be staying in their homes. They're going to be gathering at shopping malls. They can go to restaurants, they can go to gyms, they can go to each other's houses. At least at school, where it's a controlled environment, the schools can ensure that they are wearing their masks. They can try and maintain a distance, and they can enforce the hand sanitizing. If we were absolutely sure that every child was staying in their home for a 2 week period, great, that works. Quarantine everyone for 2 weeks and get them to stay at home. But I can't really see that working, and thus my opinion is that schools should open and kids should be allowed to go back to school.
Well, in the midst of all this uncertainty, if the situation in places like Kenya and the UK is anything to go by, we're in store for a very heated debate around this very issue. Let me thank you for your time nonetheless. Certainly appreciate your weighing in this manner.